Hi, my name is Sarkis Bedikian, and I'm a fellowship-trained orthopedic surgeon at Mid-America Orthopedics in the Chicagoland area. I've been using OrthoLine for the last 4 years. I perform kinematic aligned total knee replacements, and I find this helps improve my patient's overall function. I believe that returning my patients back to a pre-arthritic alignment helps with less pain, improved range of motion, and early return to activities. Lantern is my technology of choice for its simplicity and precise implant alignment.
So we have preoperative x-rays of our patient today. This is a 72-year-old gentleman who has end-stage osteoarthritis and has failed all conservative measures. Preoperatively, we look at his x-rays to determine his hip-knee alignment. And in this patient, we are between 1 and 2 degrees. We are going to use Lantern in order to help reestablish our pre-arthritic state and accurately measure his angles and improve his alignments. So our x-rays were templated, and we are aiming for approximately 4 degrees of valgus on the femur and around 5 degrees of varus on the tibia. Here we have the Lantern pin guide, which is placed over the anterior femur, and that is our initial starting pin. Carefully remove it. We can see the simplicity on how Lantern just fits appropriately. So we will add an additional headed pin medially and then one laterally, which will give us our rotational stability. Once the block is fully secured, we will run through and gain our center of rotation. You can see here how simple it is to obtain the center of rotation, and then that'll give us a check mark so we can go ahead and make our alignment. We use the screwdriver to make our adjustments so we can match our preoperative templating to improve the patient's back to a pre-arthritic state. We will then use the resection guide in order to help take 9 millimeters off distally, and then we will use a knife blade, which is approximately 2 millimeters at its end, to account for the cartilage that is lost medially and make our adjustments. You can see here we're measuring to make sure where the 2 millimeters is at the end of the blade. Now we will go ahead and pin our distal femoral guide and then remove the initial pins. Now we will make our osteotomy medially, then laterally, and then using a caliper, measure so that if we need to make any adjustments, we can make it accordingly in a stepwise fashion. Here we're checking the cuts just to make sure we are being accurate. And with using Lantern, everything is as simple and accurate as it can be. Now we are performing our distal femoral size using our desired manufacturer sizing guide. We're going to cut our posterior condyles in a similar fashion, starting medially, followed by laterally. But after each cut, we'll go ahead and measure the thickness as previously described so that we have an appropriate 8 to 9 millimeters of resection, which does include the millimeter plus of the saw blade. Now we focus our attention onto the tibia. We have placed the Lantern tibial guide, secured against the tibial spine, and then pinning it with the headed pins. You can see here we are advancing and how simple it is. Finding the lateral malleolus, followed by the medial malleolus. And once all those points are registered, using our preoperative templating, aim for the 5 degrees of varus and trying to match the patient's slope, which in this case ended up being 5 degrees. Here we're going to match our resection both medially and laterally using the 2 millimeter / 10 millimeter guide, making sure we are accounting for the remaining cartilage and making sure we have equal cuts on both the medial and lateral side. Once completed, we will pin the osteotomy guide and then go ahead and use the oscillating saw to perform the osteotomy in a standard fashion. Once the osteotomy has been complete, we will go ahead, remove the bone, check our cuts with a caliper, making sure we resected 10 millimeters evenly on both sides. And we are measuring this at the remaining articular cartilage. Again, we caliper everything to make sure we are being accurate. Next, we're going to go ahead and use a spacer block to make sure that we are stable at 90 degrees of flexion, and I do not remove the Lantern guide. Once we remove everything, we go ahead and put our trials in, We keep the pins in just in case we have to make any adjustments, checking the stability and extension, liking everything that we feel. At this point, we have placed our polyethylene, finding stability as well as patellofemoral checking, and we are happy with the outcome. I feel that Lantern is simple and efficient and helps me achieve my goals of getting the patient's pre-arthritic state reestablished. I can take the templating and execute it in surgery so that I'm trying to hit the mark every time. I believe with Lantern, I'll be able to make positive improvements in my patients' outcomes to return them back to their functional activities. Lantern is my technology of choice now and in the future.